Are we on? Oh, we're right. We're good. Okay. Matt, thank you. Well, good afternoon as it now is, and can I formally welcome all of you to this meeting of the Health Education England Public Board meeting. You're all very welcome. Matt, I wonder whether you could just run through who we've got in attendance, please.
Yes, sure, Chair. In alphabetical order, we have Andrew George, Andrew Morris, Callum Pallister, David Farrelly, Ella Clifford, Emma Bain, Andrew Foster, Hannah Lacey, Hannah Skidmore, Isabel Young, Joe Linehan, Christine O'Leary, Laura Roberts, Lisa Wilson, Liz Meir, Lizzie Smith, Navina Evans, Patrick Mitchell, Rob Smith, Sandra White, Shona McLeod, Sir David, Harpreet Sood, Soraya Dillon, Vicky Diaz, Wendy Reid, Keith Wright, and myself.
Okay, thank you very much, Matt. And we've got apologies from John Latham, Lee Whitehead, and Mark Radford.
And Giles Denham, Chair.
And Giles, thank you, Matt. And I understand, Harpreet, that you've got a commitment, so you need to leave at about quarter past 1. Yeah, thank you, Harpreet. Patrick, I understand you want to say a few words by way of memorial for a colleague. So, Patrick, if I could invite you.
Thank you, Chair. Just to let the board know, it's very sad news that Professor Peter Koperman passed away 3 weeks ago. Peter has been a huge supporter of Health Education England since we were established. He was hugely influential in our pharmacy programme and the development of pharmacy reform, and has led first of all the Physician Associate programme, and then more recently the Medical Associate programme since its inception. Peter and I worked together at St George's when Peter set up the first PA programme in 2008, and we worked together on that. So for me, I've known him since that time and worked very closely with him, particularly on PAs. And if you think there was one programme in 2008, there are now 35 PA programmes in 2021. A huge contribution Peter has made, and the fact we now have regulation, we have a career programme for this group of people. Peter was a huge influence and supporter of us. He was a friend, he was a confidant, a great person, and very patient with us, but great tenacity in terms of how he brought forward and made sure a 4-country approach, particularly to the MAP programme, was undertaken. So it was important to report that this morning, and I suppose for the board to be able to send our condolences to his family.
Thank you, Patrick. So if the board supports that, then I will write to Professor Koperman's family and pass on the condolences of the board. Patrick, thank you for that. So if we could move to item 2 on the agenda, declarations of interest. None have been notified to me as changes since the last meeting, so unless anybody wants to make a contribution, I'll take those as read. Okay, thank you very much. If I can now turn to item 3, which is the approval of the draft minutes. We've had no corrections notified, so if I deal with accuracy first, are we content to accept those minutes as a record of our meeting, our last meeting on the 18th of May? Yeah, people nodding, thank you very much. And again, there've been no notifications of any matters arising, but does any colleague want to raise any matter arising that isn't elsewhere on the board agenda this afternoon? No, okay. So Matt, I think we can accept those as agreed minutes of our meeting on the 18th of May. Thank you for that.
Thank you, Chair.
Item 4 is the board agenda planner, which sets out the agenda pretty much to the end of the calendar year. You can see the items which are planned to come through the year. I invite you to note that, but also if any colleagues have any comments, there's always the opportunity to make the comment directly to the Secretariat. At other times, during the month anyway, but is there anything anybody wishes to raise now? No, okay. Thank you for that. So that brings me to item 5, which is the committee chair's update. And since our last meeting, there have been 3 meetings. The People Committee with that chaired by Andrew Foster, the Performance and Assurance by Andrew George, and then Remuneration by Soraya. So Andrew Foster first on the People Committee. Is there anything you want to draw the board's attention to from the People Committee?
So the last substantive meeting of the People Committee was on the 4th of May, and the headlines of that were reported at the May board. We did have a special meeting of the People Committee on the 9th of July to discuss the relevant portion of the board assurance framework. And we made contributions to what was already an extremely well drafted section, and that will come into an agenda item later on today. And I don't believe there's anything else to report.
Okay, thanks, Andrew. Andrew George.
Thank you, Chair. So we met, as you said, on the 10th of May. No, we met more recently. We met last week, and we saw the July performance report, which is coming here. Early in the year, everything is green and on course apart from one item, and we had a discussion around that, which is the HEICS primary care training hubs, which is amber. Stated, the narrative stated because of a lack of long-term funding, and we had a discussion around that one, and we heard from the Finance Director that situation is probably actually not unusual in that respect, but there are other issues around these hubs. And so while we agreed with the amber, we asked the executive to reconsider the narrative around it, because we felt the narrative was perhaps not fully reflecting the situation. The other things to say is the we looked at the regional performance and the variation in regional performance. We saw some new metrics that were presented around that one, and while there is some variation in performance, the committee considered it's less than we might have feared, and there was no obvious pattern, but we'd agreed that we would that while we would review this performance and individual items when appropriate, the data would actually be shared with the regional performance fora, which have just started in July, and that data would be used there, and we would see it by exception. I think the only other 2 items very briefly is we received the annual report of the Performance Directorate. We have to commend the enthusiasm and the commitment of Joe and Helen, who presented that one, and saw all that they've done in the year. And we also reviewed the report on the performance and the financial risks of the COVID disruption to training. This is still very much work in progress. There are a lot of balls still in the air, a lot of moving pieces, but we were assured that that Callum and his team were on top of this, and that there was as much certainty as we could do in the circumstances, and we would receive a full report later on in the year when things are more certain. Thank you. Happy to take any questions.
Thanks, Andrew. Soraya, is there anything you want to add on the Remuneration Committee?
Well, just to summarise that on the February meeting, we did our standard review of executive and senior managers' pay within the DHC guidance. We also looked at executive team realignment. The CEO presented some of the changes around the realignment and portfolio. And we also received a policy on flexible retirement that HEE had updated. Our May meeting, we received a paper to look at the appointment of our new Director of People and Culture, which is, I think, currently in recruitment. Thank you.
No, thanks, Soraya. Thank you to all 3. Are there any questions that colleagues wish to ask any of our 3 colleague chairs?
So, David, I don't have a question, but PAF did meet a couple of weeks ago, and I'm sorry I didn't pick up that it wasn't on the agenda. I'm prepared to report back, but yes. I can bring it to the next meeting if you like, because we don't meet again till October.
Oh, let's do it. Let's do it now, Liz. Yeah.
Okay, thanks. Yeah, so PAF met a couple of weeks ago. So David attended, so we met on the 5th of July. Our first item on the agenda was Shona came to give us a presentation about the medical education and training reform and junior doctors' working lives progress report. And this was well received by PATH members because a number of them sit on groups that contribute to that programme. And they had a lot of comments on and questions on the things that were raised in the report, but also the look and feel of it actually, like the photos looked like they were all from secondary care. So Shona took those away and made changes, which was great in response to PATH members' comments. We had the Health Education Women's Network present to us and gave us a presentation about the network, how it had formed. It's a safe space for women's challenges and development. And there were some really good questions actually about how do you make sure that you're reaching the outcomes that you want, how you're looking at pay gaps, health disparities. So PATH members were really interested in that and felt they were getting involved in the work of HEE through some of the presentations we're having. We also had a discussion about some of the ways we're working. So the meeting virtually, obviously we've had to do that, but we have one PATH member who has he has issues with sight and he can't really contribute virtually. So we're going to try our next meeting in October as a hybrid meeting, hopefully if we can do that, with some members coming into the meeting, others accessing virtually because it might fit with care responsibilities or health challenges. Mark gave us an executive update around COVID, around integrating PATH members into some of the work of HE and how we might do that, and thinking about the impact of COVID on HE staff. And then we just had some general feedback on the health and care bill, about the spending review and how that might work out, just to bring PATH members up to date with some of the wider context we're working in. And then we had a really good presentation on blended learning, how that's supporting HE staff and trainees, and then we thought about how HE can engage PATH in a better way. We have a document that's called Principles to Apply When Engaging PATH, and we've been updating that so that we can be as much help to HE in terms of PATH members commenting and being involved as they can. So that's ongoing, and we will take that back to our next meeting to sign off and to discuss with colleagues.
Thanks, Liz. The thing that strikes me about that committee is the volume of work that it undertakes, but it's all undertaken in working groups outside of the committee, with members, those committee members joining working groups right across the organisation, and a tremendous contribution that is made individually and collectively by those colleagues that enriches the work that we undertake. So it was good to spend time with you, Liz, and with other members of that committee. So Navina, let us move on and invite you to make your update report. Thanks.
Thank you. Thank you, David. We're actually been quite busy, so I've got quite a lot to report. I will try and be succinct. Just to say, to start off with, I want to make sure that the board is aware that HEE is working very closely with our partners in service around the issues to do with the pandemic, very much keeping up to date with current pressures and on service in the different regions. I have no exceptions to report at this moment in time, but if there was anything that we were particularly concerned about before the next board meeting, we will have an extra board briefing for you. As well as that, we have been also working collaboratively with our partners in NHS England and Improvement and the department to talk about the align our finance service and workforce planning to inform the spending reviews. Also ongoing reform work across medical and nursing education. And also now we've got the strategic framework, which I'm going to talk about in a minute. So all this work we cannot do without collaboration with our partners, and I really want to stress that as a overarching theme for all of my report. So I will start with the long-term strategic framework for health and social care workforce planning. HE has been commissioned by the Minister for State for Care to work with our partners and review the long-term strategic trends for health and social care workforce. This will review and renew and update the existing long-term strategic framework for the health workforce, HEE's Framework 15, in order to help ensure that we have the right shape, skills, values and behaviours to deliver our clinical services and care services to very high standards. This is the first time that the framework will also include registered professionals working in social care, like nurses and occupational therapists. So this is a hugely important piece of work for us to be convening and supporting in very close collaboration with our partners in Skills for Care, in the department, in NHSE and I. So it is a huge privilege for us, and we will have to deliver at scale and pace as a convener of a system-wide conversation. Involved in this, we will have to look at what transformation is needed, and we will be inviting stakeholders like service users, the population, carers to get involved in a call for evidence and an engagement exercise which will help to inform the final framework. So the first stage of this work is to build on engagement, which has been part of the People Plan. People remember the NHS People Plan, and develop the ongoing conversation with partners and stakeholders about the long-term workforce planning. So we're starting this work this week, where we will issue a call for evidence to identify the factors that will have greatest impact on demand for health and social care sector over the next 15 years, and what this will mean for workforce supply to support the population. This call for evidence will be open until the 6th of December. And then after that, building on the analysis we garner from the call for evidence, we then will have some engagement events between October and February to review the evidence and to ask that kind of so what question. There's a whole range of activity, including subject-specific workshops, virtual forums, and interviews to explore themes and issues in more detail. The key here is collaboration, listening, trying to gather all the views, and then making sense of it for the framework. So as you can tell, it's a very detailed and huge piece of work, and we will bring updates to the board. We'll take questions in a moment. Can I just move now to the spending review update? Again, we continue to prepare for spending review submission, and in collaboration with NHSEI and the department. And we've been doing this work now for some time with them. So the first thing we've done is shared our baseline plans so that they can be scrutinized by our partners, and hopefully they will be signed off shortly. We are leading some elements such as education and funding reform. We are also leading on plans for service demand in the recovery phase, covering the next 3 years, but also in the longer term. And we're trying to make sure that whatever we do in terms of the next 3 years also fits with the wider workforce plans and in areas such as retention. It's hugely important that we work really closely with our NHSEI partners to model return on investment, and we must agree with them on areas that we will prioritize. So again, the key theme here is the collaboration and the balance between actions that assist the NHS in recovery, but also making sure we have an eye on the long-term sustainability for services. And again, this fits with our strategic framework work. So we are going to be testing key assumptions by the end of August with our partners, and then with the department thinking about the formal submission, which will probably be towards the end of August, beginning of September. We will bring another discussion for the board before that if necessary. If I may move on now to postgraduate medical training recovery. So HEE established the Postgraduate Medical Training Recovery Programme to ensure that continuous supply of medical workforce is high on our agenda as we recover from the impact of the pandemic. and to make sure that the medical education program is responsive to current and future needs of patients and communities. We can answer questions about the program, but it's in kind of 3 stages. The first stage is around reset, which started last year and is carrying on now, where we are looking at the adaptations initiated during the pandemic to protect training progression and looking at what worked well, the impact, and especially the impact on trainees. And so that's the first phase. The second phase is around recovery, where we're looking at how we enable trainees to gain the essential competencies that might have been lost or were not accessible during the peak of the pandemic, and also more equally important to address well-being issues and any issues around the competence gaps, and also enabling trainees to evidence their competencies that they gained during the pandemic and where these could be aligned with activity, where this activity could be aligned with service recovery. And then the third stage, which is an ongoing stage, and it overlaps with stages 1 and 2, is about the reform program. So whilst doing the other bits of business, we're making sure that the reform is aligned with the reset and recovery. So that's quite a big piece of work for Wendy and the team to undertake. We of course recognize the pressures on the service, and there's always going to be a bit of a tension between training, recovery, and service. And so this is a very live conversation and discussion and requires considerable collaboration between us, service, the regulators, the colleges, and other interested parties. If I can move on now to medical recruitment. So more activity here, really pleased to provide a short update on recruitment to CT1 and ST1 training. The fill rate in England across all specialties is 99.18%, a record number of 7,846 doctors accepting posts, despite the challenges of the pandemic in delivering the recruitment exercises. I think that's really quite remarkable. Competition ratios for recruitment were high. There was a 35% increase in applications, and partly because of the overseas travel restrictions, resulting in more UK trained applicants, and also the impact of the health and care worker visa attracting more internationally trained applicants. So the geographical preferences can result in fill rates under 100% for some specialties, despite the increase in applications. So looking ahead, we have to plan ahead for the next round of recruitment, which opens this month for training vacancies, which start in January of 2022. So it's a continuous process, and colleagues are building on the lessons that we've learned from 2021. And HEE will be placing additional focus this year on communications to applicants, because that was something that people raised. They wanted us to be better of. And we must ensure that they are more aware of competition ratios and are supported and informed throughout the recruitment process. That was based on some of the feedback that we got. I move on now to enhancing junior doctors' working lives. The programme, which was established in March of 2016, was to address a range of issues that affect the quality of life for junior doctors. It's led by HEE, cross-system collaboration, and it's about delivering meaningful change to postgraduate medical training. So we have a report which is co-produced and led by trainees. It's 4 trainees, and it's developed through collaborative working across systems, including the GMC, the BMA, the Royal Colleges, and NHS employers. So there are a number of headline messages, which I will just highlight some of them here. The headline messages from this year's report were around expansion of flexible training opportunities. I have some detail in the report, which I won't go through now because of time, but we could pick up if colleagues want to ask questions. But the headlines are around expansion of flexible training opportunities, There are some issues around recruitment and deployment. And so we want to focus on dynamic recruitment and more flexible recruitment processes, and also the cost of training. So there is an ongoing commitment from all Royal Colleges to be transparent in the use of income obtained from trainees, for example, examination fees. And the colleges are really working together with us and trainees around how to do this. The report is attached, and we can go through questions in a minute. Finally, I've got a couple more bits to tell you about. The future of work at HEE. We've been very busy. In May, I updated the board on an important piece of work that we undertook within HEE around the future of how we do our work. And we did some consultation with our colleagues. We had more than 1,900 colleagues respond, and we've got that information. And we have some good news on what we need to build on, how we enable everyone to work safely, how we use tech, how we use remote working, and also how we use mixed ways of working. People also gave us feedback on what they want for the future on how we work in HEE. So at this moment in time, we are assimilating that information. We'll be sharing it with all of our colleagues within HEE, and then start to plan how we use that information to enable the next steps in how we work as an organisation. On Thursday, the 15th of July, our annual reports and accounts were formally laid in Parliament. That is really good news, and we're very proud that we were able to do that. So I want to thank all HEE and National Audit Office colleagues who've been involved in the production, certification and publication of our report. And the report is available on our website and also on the government website. Some good news to end on awards, please. I'm really happy to bring to the board's attention 3 recent examples of our HEE's impact being recognised and celebrated by others. Talent for Care National Apprenticeship Team won the Annual Apprenticeship Conferences Awards, outstanding contribution to the development of apprenticeships. This is so important. We don't talk often enough and recognise the work that apprenticeships and the potential in apprenticeships. So really proud of that. Secondly, Dr. Rajiv Sethi, a junior doctor in the Northwest, was recently awarded an NHS Parliamentary Award, NHS Rising Star, for his work on developing and supporting platforms focusing on widening participation, sharing knowledge and promoting global learning. And during this last year with the pandemic, that's been really wonderful to see. And finally, our fellows, Vidushi Golash and Rais Lunat, who I think the board know well, together with Liz Hughes and Mike Masding, have won the Royal College of Physicians Excellence in Patient Care Award for Medical Education and Training in recognition of the introduction of interim foundation year 1 doctors. And this is, again, a really useful, helpful thing that we did during the pandemic. Gosh, I've really rattled through that, but it's been so busy. So thank you for your patience. I'll take questions now.
Okay, well, let me just pause about how we get through this meeting in the time allocated. So can I put all presenting directors on notice that we're going to take your reports as read? So I just want you to concentrate on the 2 or 3 things you would like questions being brought forward on. Otherwise, we've got no chance of getting through this agenda in the time that we've got allotted. And that was a 15-minute item that took 15 minutes to present. So just, I said I'd do this publicly, and I intend to do it in that way. So my money was always on you, Andrew George, to get your hand up first. You beat Soraya by a nanosecond, but Andrew George, over to you, please.
I'll try and be temperate in my time. Naveen, a very good comment, but I won't waste time saying nice things about it because it was lots of very good things happening. I wanted to make something that cut across several of your themes around the flexible training, the junior doctor, coming up in the programmes, and that there doesn't seem to be very much mention of what used to be called staff grades. Now I think we're meant to call them speciality doctors, but people still often refer to them. And many trusts are now recruiting these people, putting in training packages for them, then getting them into consultant through the CSER route so that they're doing it independently. Now I know that they're not part of us because they're not trainees, but they are being treated as trainees. They are going on training programs, are often mirroring our training programs. And so my question is, how are we making sure that this is tied in or not tied in with us? And what's your thinking around that one? Because it strikes me as a potential problem we have. Thank you.
Okay. No, Navina, can you hold? Otherwise, I'm really worried we've got people waiting to come in from outside, and I'm just really worried we're not going to get through this agenda. Soraya, please.
I'm happy to default.
No, go please. I don't want to cut it. I'm just trying to get the balance between cutting across debate and doing it. So please.
Navina, excellent news, and I think congratulations in terms of the work you're going to now do on long-term strategic framework, bringing that up to speed. Just two little points. One about the engagement, whether voluntary sector and charities are going to input, especially around the social care element. And then the second point, it was conspicuous by its absence, but I'm sure it's not absent, and it may well be under the scope under demographics and disease, the whole agenda around health inequalities, because I think it's really important to have that firmly embedded.
Okay, thank you, Soraya. Any more colleagues? As I say, I'm just trying to manage time, not stop people raising questions. Okay, can I make two comments, Naveen, if I may? Firstly, just how important it is to accept the commission from the Minister about the long-term planning. I think that's a tremendous affirmation of the purpose of HEE, and we look forward to that work proceeding through this year and into next year, as you've set out in the annex to your report. Secondly, I think I can speak for the whole board just to say thank you to Callum and the team for the annual report and the finances. Nicola, I know there's a lot of work to get that finalised, but just pull out and pay particular tribute to our colleagues who have won awards this year. That was the place that you ended up, and we do not celebrate success sufficiently well, and I think it's right that we give our applause, thank you, Soraya, to the colleagues that have been recognised for their achievement. It's very encouraging and affirming to see that, and I have to say I'm immensely proud of their achievement and the recognition of their achievement. So thank you to them. My question, though, is on medical recruitment. One of the debates around medical recruitment is doctors left without jobs, and I'm rather presuming that what this fill rate means is that all doctors will be in employment as a consequence of the fill rates. But I can't quite square the issue about geographical fill rates. This might be my understanding. So I understand what we've not got adequate coverage on geographical fill rates, but I'd just like to understand the 99.18% and the geographical fill rate point that is being made. The people have shook their head at me, so I've not quite got that right, but I'll leave you to come back, Naveen.
So just to very quickly pick up on the points, the specialty doctors, HEE does support them, and perhaps not, we could give you some of that information outside of the meeting. With regards to the strategic framework voluntary sector question, we will be consulting widely, including the voluntary sector. And I take your point around making sure that health inequalities has a high profile in the work that we're going to be doing. With regards to the fill rate question, I will hand over to Wendy to answer that in more detail.
David, we're not the only employers of junior doctors. That's the first thing to say. So the employment issue is not something that we are completely in control of, because doctors that don't get into training will work in non-training posts, and that's a very common sideways move for many of them during their training, and that's part of our flexibility agenda, is to allow that, recognise it and track them through it rather than have it as a default position. We do have variations geographically. It is harder to fill some specialties in some areas. Geography trumps specialty choice when you come to the very large specialties, and the small ones like neurosurgery, they fill because they're competitive and they fill wherever you are in the country. Our stock of training posts flexes because we have people returning from training, from maternity leave or time out of program. So the numbers of posts we fill is not a static number, and it goes up and down with the variation in trainee behaviour, as well as the number of posts we need to make programmes work at a particular time. So Rob Smith's the expert on posts versus programmes and numbers, but what we can say this year is that in a year when we were concerned that we'd be losing junior doctors from the NHS and from training, we have not. We have increased the numbers of people in training posts. We are embracing non-training posts through the generalist school offer, which is, I think, the next really big step, because those are not the SAS grade. Those are, if you like, to coin a Ken Kalman phrase, a bit of a lost tribe, the trust doctors. And by sharing both the expertise within the education sector and the opportunities that allow people in and out of training, we will flex that resource much more effectively for trusts, and it's something that makes the generalist school programme very attractive to employers. Happy to go into the complex details of recruitment in any region as the NEDs get into their regional support at any time. We've got breakdown right down to the localities now of all the data. You're on mute, David.
Thanks, Wendy. The positive news from this is there are more doctors in training than we've had hitherto, and that's one of the outcomes of this training round. Okay, thank you very much. If I may, Navina, unless there's anything you want to add, I'm going to move on. No? Okay. So it's my job now to welcome Lisa Wilson and Sam Goddard and two of our graduate students, Ella Clifford and Emma Bain. So can I invite you to kick this off, Lisa, bearing in mind the time, and we would like to hear from the graduate students as well. Thank you.
Yep, thank you, David. Afternoon all, and actually you've just done all I was going to do, David, which was just introduce colleagues to you. So Sam is instrumental in creating the scheme, and Ella and Emma are two of our graduates on the current programme. So I will do no more other than to hand across to Sam.
Thank you. I have a very short presentation, and then, as you say, I'm going to hand over to two of our current graduates that are going to tell you a little bit more about their experience while they've been on placement with us. So my first slide, I just wanted to make clear that this is part of a wider agenda in terms of widening participation and HE careers here at HEE. We also take part in the Civil Service Fast Stream programme and the National NHS Graduate Scheme as well. So this is in addition to that one. And also that we've got an established apprenticeship programme, and we are working with the Widening Participation and Skills Development team to build on that. So our scheme really provides individuals to gain experience in the workplace, either as part of a sandwich year, as part of their degrees, or those that have completed their degrees already. Which just allows them to create those connections and really learn firsthand what it is like to work in an organisation like ourselves. So just to give you a little bit of the background, we started from very small in 2018 and 2019. We just ran this in the HR and OD team. Of those 4 individuals, 2 of them are actually still with us today, and one of them does help us run the scheme each year now as well, which is great. In 2020, although a lot of the schemes were being cancelled across the country, we decided to move forward with ours, and we appointed 22 individuals to placements across the organisation, both regionally and nationally. But obviously this has clearly grown because this year we actually got over 1,400 applications, and we appointed 24 individuals onto those placements, which will start between now and September. And we do offer each placement student a full induction into the programme, support throughout, network opportunities between themselves, and also opportunities to undertake further training and CPD whilst they're with us. And I just wanted to show this slide just to show the activity that graduates have been involved in whilst they've been with us. As you can see, a wide variety of things. And they also helped us with the recruitment this year's scheme. So they gave us their ideas, suggestions, improvements to what we did last year. So we incorporated that into our scheme this year. And just of those 22 people we had this year, 12 of those will be returning to university in September to complete their degrees, but 10 of those did actually come as a graduate. They'd completed their degrees. 8 of those are applying or have been appointed into jobs within HEE, which is fantastic, and 2 have secured roles externally but still within the healthcare family, and 1 is going to become a nurse through an apprenticeship, and the other is joining the Academy for Healthcare Science, so great for those. But like I say, I'm quickly rattling through that in terms of what the programme is. I've now got 2 of our current graduates on the call that are going to speak to you about their experiences. So we have Emma and Ella. So if I can hand over to Emma now to give her view.
Yeah, thanks, Sam. Hi everyone, I'm Emma. I'm a placement student who joined HEE on the graduate and placement scheme in September. And in a couple of months, I'll be going back to Durham University to finish my history degree. So my time at HEE has been incredibly varied. I've had the opportunity to dabble in so many different areas of work, and in the process, I've met so many amazing people. When I first started, I worked in the National OD team along with 3 other graduates. And in this role, I helped design the Best Place to Work microsite. I edited and transcribed videos from the corporate inductions. I streamlined the internal apprenticeship recruitment process, try and say that 3 times quickly, and much more. In January, I moved into my current role as a staff engagement officer, joining the brand new national staff engagement team. So between the 2 of us on the team at the time, we managed to juggle the running of the We Are HEE Values and Behaviours online conversation, lots of tongue twisters today, as well as the procurement process of the colleague survey, which is actually live right now. It launched last week. And although this may sound slightly stressful, I really relish the opportunity to take on larger responsibilities and really grow trust in my own initiative. As a result, my portfolio and my leadership skills have grown, as well as my resilience. Now we're a much larger team of 3, and I now have the skills to independently manage my workload so I can help out wherever needed in the team. It's hard to pick just one thing that I've enjoyed working on the most, but if you really pushed me, I'd say anything colleague-centred. So for instance, working on the new HEE Values and Behaviours. Every step of the journey, from being directly involved with their creation to taking ownership of the internal communications that are currently promoting the values, has been so rewarding. Getting to speak with colleagues one-on-one and sharing their stories of how the values inspire and challenge them has been a privilege. And it feels like I've really been able to make a difference in my time at HEE, which I couldn't be more grateful for. It will be a disservice to talk about the benefits of my placement and not mention all the incredible and immensely talented people that I've met and got to know so well, despite the fact that I've been working entirely remotely. From my line managers to my team members to all the grads on this year's scheme, there's simply too many to name. And who knew you could actually make friends through a screen? That's kind of one of my big takeaways from the year. Everyone has been so kind, supportive, and genuinely invested in my personal development. The people at HEE have defined my year and made it an experience that I will never forget. Now, this is the part where I try not to get emotional and think about the fact that I'm leaving HEE in 6 weeks' time, but I've had the best year and I couldn't recommend the scheme enough. Well, actually, I convinced a few of my friends that are graduating this time round to apply for the scheme, and I'm so pleased and admittedly slightly jealous that some of them will be joining next year's cohort. And if they manage to have 1/10 of the fun I've had this year, it will be so worth it. Thank you for listening, and I'll pass on to Ella now.
Thank you, Emma.
So I'm Ella. Good afternoon, everybody. I'm currently on placement with the Secretariat and Private Office team in the Corporate Accountability and Engagement Directorate. I do quite a bit of work around the boards and committees, so I don't know, maybe some of you recognise my face. I've done lots of work surrounding live streaming, and I've learnt so many skills such as diary management, SharePoint management, sending out comms, updating our website, and designing all sorts of calendars for the corporate team. Since starting at HEE, not only have I learnt these really valuable skills that I'll be able to take on to university and through the rest of my life, I've also would like to share with you guys that I've been able to be a part of the Ideas Lab project. So you might recognise the Ideas Lab. It's at its most basic form, it's a staff suggestion scheme, and we're currently testing our wonderful app that has been designed by the cloud specialist team. So hopefully that will be ready to be launched in September. And when I started last September, so unfortunately I won't be able to see it launching, but I'm sure I'll stay in touch. And last September, I was trusted as soon as I started to start researching for the Ideas Lab, and it's actually moulded how it looks today. So that's really great and just an amazing opportunity that I've had at HEE. And earlier on this month, when we had our graduation for the HEE graduates and placement students, I was asked what my proudest moment has been so far, and immediately I thought back to February when I got a chance to present at the NHS Project Futures Festival. So I don't know if anybody attended, but we were given a hackathon to take part in. So we had an absolutely amazing week. At the start of the week, we were given a problem to solve. We were sent a pack of Lego Serious Play, and we got to have a mess around with that and build prototypes. And at the end of the week, I was fortunate enough to present at the closing ceremony of the festival to lots of lovely colleagues. So yeah, immediately I thought of that because it was just an absolutely fantastic experience that I could have from my home in the pandemic because of HEE, and I'm so grateful for that. And also I'd just like to say that a few things that I've learned this year. So I think my team especially have helped me to realise that there is so much value in having fresh eyes and new ideas, and I now have the confidence that there is value in my new ideas, and that I should be confident that I have helped all aspects of my team. And I would just like to finish by saying thank you to everybody at HEE, and I think I speak on behalf of all my fellow graduates and student placements when I say that. Thank you, and I'd just like to pass back to Sam.
Thank you both. That was great, and I think Lisa mentioned this at our graduation event. You've grown since you've come here as well, because to come on and do that at the start, your confidence has definitely grown. So thank you for that. So I'm open to questions now if we've got time, or happy to answer them offline if we haven't.
Well, let's just take comments and feedback. I don't know you need to respond to them, Sam. I'm not quite sure any of that needs a response, to be absolutely frank. I think it speaks for itself. I will say something by way of conclusion, but Soraya, please, and then Liz Meir.
Just to say to David, really to both Lisa and the team, amazing, and thank you to Ella and Emma. It's always heartening to see placements work really well and set you up for the future, and so good luck, but really heartwarming, and I hope we continue as an organisation to support placements because they're so good, both the organisation as well as the individuals that come on.
Thanks, Soraya. Liz?
Yeah, so just to echo that, but also to say sometimes you hear people who have been on placement and they might have shadowed people or sat in meetings and it doesn't sound very dynamic, but what you've been doing and making a real difference to people's lives is absolutely fantastic, and how you present it today has just brought it to life. So thank you to Emma and Ella, and also to Sam and Lee. So it just sounds like a great programme.
Yeah, endorse that. Anybody else want to come in? Could I Emmaella, what would your advice be to us about one thing we could do to improve the experience of graduate students? So you've been very complimentary about what's gone well. With your newfound confidence, both of you, what would you recommend that we do to improve? Ella.
Can I go first? Sorry, I don't want to seem too jumping in there like I've got something on the tip of my tongue, because it has been amazing and I can really hardly fault it. I think for me as a placement student, and this is something that we've raised because obviously we've been involved with next year's cohort, is just that my needs are slightly different to a graduate's needs. So I think that that's something that's really going to be picked up next year. But as a placement student, I could do with, I've been doing modules this year for my university. I need kind of more appraisals, more formal appraisals, probably duplicate appraisals because ones I've got to send to my university. And obviously graduates will need different things from their managers. So just to say that and just make sure that that's probably addressed next year. Thank you. I'm happy to jump off the back of that. I completely agree with Ella. I'm also a placement student, but I found that I've been incredibly lucky with my line managers. They've supported my objectives from day one and made sure that the work I'm doing directly falls under my objectives. So I've been meeting them the whole year. I think personally, I would say maybe not something to improve on, because in my personal experience, I've had immense opportunities, plethora of opportunities. It's been incredible. I'm sure you kind of got that from my speech, but yeah. One thing I would say is just give your graduate or your placement student the room to be creative and give them the work and trust them to get on with it. I think the worst thing you can do is kind of not let go of their hand. I found that really early on, so within the first couple of weeks, I was being given projects to take on and do myself. So I don't know if any of you remember, but in October we did the Best Place to Work video project, and that's something that I led on, and I'd only been at HEE 4 weeks by that point, but I managed to meet so many people in that time that I started building strong relationships so early. I found my feet so much more quickly, and it allowed me to just kind of really grow over the year. So I think it can be a bit nerve-wracking for both parties to kind of let go in a sense, but you're not, because you're still giving them that support. But just trust, I think, trust and confidence in your student or your graduate, and I think that nicely falls under the HEE values. So yeah.
Ella, Emma, thank you very much for your contribution, both at this meeting but also over the past 12 months. I have great hope for the future of the country when we've got young people like yourselves developing and creating your careers. I think your presentations, your clarity, your thoughtfulness, your emotional intelligence shone through both of your presentations. So great big applause to both of you for the confidence in coming today, but also for what you've done over the past 12 months. So thank you very much. Sam, Lisa Wilson, Sam Goddard, a massive well done and thank you to you for setting up that scheme. Sam, your presentation of this alongside other graduate schemes and the contribution it makes, and just your figures for the last 12 months, with 8 of the grads going into employment within HEE, but also 2 going into other aspects of work in healthcare, I think just makes the case of doing something differently, leading to a talent recruitment process. I think Ella and Emma, you've just had a 12-month selection process basically, and actually that speaks well for the way that HEE is working and dealing with the development of a talent programme. So a big well done to both of you two and the teams that work with you as well. Okay, thanks for that, and let's move on to strategic planning, the board assurance framework. Callum, do you need to introduce this if we've all read it? Is it worth me just going to invite questions? You're asking us to confirm and agree the approach that has been taken, but let me now hand over to you, and if you just need to frame the conversation you want us to have, I'll invite you to do that.
No, I think we'll get pretty much straight into questions. So obviously we've got the board assurance framework. It's very much still developing. We'll continue to develop, aligned to our opportunities. We've mapped it against committees, put some controls and assurances against that. It's really now up to you to comment on that. Obviously, we've got limited time in this meeting, so I suggest any detail points. Very happy to deal with those offline. It's really now really a question mark of just discussing anything major in there that we feel needs airing and agreeing collectively. The only thing I'd continue to say as well is I propose that we ask our internal auditors to look at this as part of a governance review later this year as well, once there's a few more months down the line with it. But really welcome your feedback.
Okay, so let's do that. It is the annex to the report is work in progress, isn't it? That's why there are gaps in it. That remains to be filled in. So what you're inviting us to do is not so much comment on the detail, but comment on the general approach and whether we've got the right major areas identified. Is that right, Callum? Just to try and focus the discussion. Okay, so thanks, Callum. Let me open up the conversation then to colleagues. Is this heading in the right direction? Do you think they're covering the right areas? And can we give Callum the thumbs up to proceed in the way that is outlined? And then I suppose where we'll add value is, do you perceive any gaps in the work here that needs to be built into the next stages? So is this the right direction, and what are the gaps might be the most helpful way to just advance the conversation. So Andrew, George, and then Rob, and then Navina, please. Andrew.
Thank you. I mean, so I've already emailed Callum about this. I've got two questions, one of which is around the allocation of projects or lines to committees. You know, and I've looked at some of the ones that are going to my committee. I can't quite see how they fit in. On the other hand, maybe what we've just got to do is live with it and I guess the situation is what is the process by which we're going to live with it and review it. But then the other one is, if a committee is responsible for a line, but the director that is responsible for that activity doesn't attend that committee, how do you see that working its way through? Because that sort of ability to talk to somebody face to face seems to be critical to really get good assurance on this. Thank you.
You're on mute, David.
Really helpful point, Andrew, about alignment and just making sure we've got the alignments. So, Rob.
Thank you, David. For me, the proof's in the pudding, and immediately in our next item, we've got the operating model describing how it clarifies our roles and responsibilities and seeks to make HEE a continually improving organisation, which is BAF opportunity 1 and 5. And we've had the Ministers' Commission on making sure we focus on the long term. So you can play this back, can't you? Which is what are we seeing in our daily life and work that resonates with the strategic opportunities we've identified. So I'm incredibly happy that we've got this framing to kind of navigate us through a complex landscape.
I endorse that comment, Rob, and I think it's seeing these as a suite of papers rather than individual reports. I think is a trick to what we're doing here. So, Navina.
Yeah, so I think I partly can answer Andrew's question, that this has got to be now a live process that's got to be meaningful, and we start to use it in our committees. The second thing is that it relates to the session we had earlier in board development around the role of our committees as taking on delegated responsibility. And one of those issues, Andrew, should be that we review the membership and think about which executive directors should be included in the committees. So we will look at that with you. And then the third point I had was, even as we sent this paper in over the weekend, I thought there's a gap. I thought of a gap myself. And I think that we need to strengthen inclusion across all of the committees, and that we need to make sure that in all of our business, we pay attention to the matter of inclusion.
Thanks, Navina. Really good points. Anybody else want to come in? Andrew Foster, you put something in the chat. Do you want to make the point? I think it's an important one that does need to be made in this conversation.
Well, yes, I think there's been a truly excellent process in building it up to be a thorough and comprehensive document which reflects genuinely all the risks. I then turned to thinking about how we use it in practice, and as it has come out with this board pack today, it's now 28 pages, and I just that is much longer than the document that I used to work with within trusts, and I wonder if there's anything we can do to just abbreviate it back a bit.
Thanks, Andrew. Anybody else want to come in? Soraya, yes, please.
Yeah, just to say my experience from the trust is that actually once it's got to a reasonable stage, and I think we're at that stage, it's picked up by each of the committees, and this will be a live document to see how it works, and also to think about sort of a point, say 6 months or a year down, to revisit, because that's how you'll get some of the realignment, and just then to make sure that it's an operational working document as opposed to something that occasionally we look at.
Okay, really helpful, Soraya. Callum, is there anything? Well,
I was going to say I'm very grateful to everyone, because I think you've kind of answered some of the questions that are really going through there. I certainly agree with Andrew's point about it, you know, being wary of length, but Soraya is absolutely right. I would say our response to that is, once you know, the top end is obviously something which is pretty succinct. Once you get into the detail of the controls and the assurances, well, that's massive for the committees, I think, to consider and evolve. I do think there's a big element of just kind of working with it as it is now, and seeing how we can see how it works, and we've got full discretion to evolve it. So I don't think we need to get too worried about getting absolutely spot on from the outset. I think, you know, yeah, attendance, I think we talked about that. I'd just like to say thanks to Nicola in particular, who's obviously done pretty much all the legwork really on this behind the scenes, and it's helped us through. It's been quite a complex process.
Callum, thank you. My comments on this, David Farrelly, I hope you don't mind just drawing on the conversation that you and I had yesterday. I'd prefer we don't call this the draft BAF, but we call it the BAF, and we then iterate it. It just feels like this has been a long time in development, and I think we now need to move to agree it. So I felt very comfortable with the recommendations in paragraph 6 of the covering report. The challenge for me was the confirmation, confirm its adoption of the draft BAF. That's asking the committee to do it, and I just delete draft from that, and I think this is the point about iteration, and I'll make the same point on the operating framework later, because we've almost been discussing this for nigh on 18 months now, and I think there comes a point where if this was more down the technology line, we'd be talking about alpha and beta, and seeing it as something that we iterate. So I'd prefer we began to use that language rather than at the beginning and end. I also identify with Andrew Foster's comments that I think it's got a tad too long. I was beginning to lose the detail that was in there at the end. We'd pulled out the key risks, and the work to mitigate the key risks is what I was looking for. It seemed to me we got a lot more in there than just the mitigation to the key risk. We were back in describing the processes we have in place rather than the work we've got in place to mitigate the risks. So, but I think that will come out in the iteration of it, Callum. So, Nicola, I don't think she's on the call, but thanks to Nicola, but thanks, Callum, also to you and the people that have been working on this to get us to this stage. So with that, I think the spirit of the meeting is to agree the recommendations in paragraph 6 of your covering report. Thank you for those that are nodding, and that's a real advance, Callum, so thank you very much. Oh, Nicola is there, so well done, Nicola. That's you need to hear that directly as well. So that's good progress. So if I can move on, and I think that moves us from 8.1 to 8.2, David, on the operating model. Lizzie Smith, welcome to you, our London Regional Director. Lizzie, I've not seen you for 18 months, actually. That's the price of lockdown. So it's nice to see you here at the board meeting. I know you've been actively working on this as well. But David, if we could adopt the same spirit as with the BAF and just invite you to frame the conversation and the key issues that you'd like picking out of this conversation, then I'll open up the conversation across the board. So David, over to you.
Thanks, David. So the operating model has been revised, or being revised, to build on the plan on a page work we did probably 2 years ago, which had our core principles in, our core functions, and how we plan to operate at a national and regional level. The context has changed given the impending emergence of the ICSs and the development of the implementation and development framework for ICSs, as well as the strategic oversight framework and the emerging NHS E&I's operating principles. So we're trying to reflect back to say, does our operating model still stand with the refreshed principles and the new context? And what we've been trying to do is test the principles against our core functions in that new environment. That testing has been done across all regions with an executive body with each regional director. So we've tested at a full regional level and across our core functions from the plan on a page. As always, when you test, you get more issues arise, and there's a bit of further testing to do. But what the intention is that in the coming months, we'll have a document that outlines our principles, accountabilities, core activities, how we deliver our work across systems and internally between national and regional. And that will also be embedded with examples, both in terms of internal HE work, but also opportunities for working with systems and across ICSs. The document will also start outlining our relationship with the wider system, in particular, how regions will need to work and adapt to ICSs once the legislation has worked through and we fully understand the workforce responsibilities of a system at a system level. So the document, as with all operating models, won't be fixed in time. We'll have an operating model that's workable that we'll implement in this autumn. It'll then be adaptive depending on what's coming out of the ICS work with NHS E&I, and also to give some space for ICSs to develop themselves and get through some of the pressures they've got in terms of recovery and restart and some of the current COVID issues. So the way I see it is phase 2 testing will be in September. That will conclude ready for us to implement through the autumn, which I would hope we'll be able to do in October, November this year. That will be adapted as we get more information or more emergent findings from systems and ICSs through the year. And then there's a further piece of work, which is sort of our ambition in terms of where do we want our operating model to go in terms of us being a learning organisation, a learning system, and how that responds to our role within the system and our systems develop themselves. So there's a couple of things, Dave. One is, are we on the right track in terms of our current operating model being ready to function this autumn? Is it the right thing to do to wait and adapt to ICSs given the pressure that they're under in terms of their own development at the moment? And is the ambition in terms of aspiring to be a learning system and a learning organisation the right direction? And if so, then we can carry on that work through into next year as well. The only other thing to add would be to thank really Lizzie, Phil Carver and Jenny Cavalier, who have been really embedded in this work, and they're our key contacts both out with NHS E&I. So we're working on all of the component parts of ICS work and NHS E&I work at all levels. So we're very, very embedded in all of that, but it's very much a piece of work that's owned and led by the regions to make sure that we're sort of steeped in their reality and making sure that we're responsive and reflective to feedback we're getting, both in terms of the activities we might want to be involved with, but also the timing of when's the best time to start having conversations, given where ICSs are in their own development and system pressures. So if I leave it there, David, and invite questions really, or
Okay, thank you. Thanks, David. Liz Mayer, please.
Yeah, thanks to David. So on the question about being a learning organisation, a learning health system, I think the answer has to be yes to that. I don't think we could answer anything else that we want to learn and continually develop and work with colleagues. On the ICS, so I'm currently the Senior Responsible Officer for Digital for West Yorkshire and Harrogate ICS, and the amount of planning and work that's going into looking at that structure from each function in the ICS is just absolutely enormous. So my first reaction was to think, yes, we need to step back, but actually we do need to be part of that planning. And you know, when we're planning sort of the workforce functions, we do need to be in there. So I think it's maybe a bit of both. I'm assuming our regional teams will be all over this with the ICSs, and everyone is going to be different. So I think it's a do what we can now to respond to whatever planning cycles ICSs are going through, but also then stand back to look at the whole to see where we can, help them to grow and share between each other. So I think it's a bit of both, to be honest, which is a bit difficult, I think.
Any more comments, questions? Rob?
Yeah, I'll just come back to Liz on that. I mean, that's partly why we've adopted this integrated planning framing, because it allows us to say, okay, where do we sit? But it also says, well, but who's doing these other functions and how do they fit together? I mean, in the original people plan, we said we need to understand who does what. We're saying it's more than that. It's about how are those different levers convened so that they act in concert to meet the system goals. And one of the questions we ask is, well, who is doing that convening? And it's like a really powerful thing to ask. Because otherwise our functions risk sitting in isolation from, or they act, they don't act as collective goals. So that's why we're using that framing, just to kind of help navigate us through this and to try and see whether that helps our partners navigate that space too.
Yeah, and I think the recognition that each ICS will be very different, we need to factor that in as well. Yeah,
Andrew Morris.
So, David, that was the point I was going to make that Liz has already pointed out. I think we've got to strike the right balance between consistency of approach, but still having a local flavour. And, there are some ICSs that aren't intending to appoint a chief people officer, which really worries me. So you've got that at one extreme. And at the other end, you've got ICSs who are saying, yeah, the chief people officer should be a board position having the same status as the medical director and the chief nurse. So I think there's a real trick here for HEE to pull off around consistency of approach, around how we support regions and systems, but still give them some local flavour. And I think that's going to be really, really tricky going forward.
Yeah. Really important points to be made generally. Anybody else want to come in on this item?
Sorry, can I come back on that, David?
Yes.
I just thought it was such a really good example, because our framing kind of says this is the function that needs to get done, which is a convening function. Of course, how you do it might be relevant to your local circumstances, not least who's convening the service planning is also on that slide. But if you have a framing to ask the question, then you can say, so why do you think not having a CPO is appropriate? How are you going to do it otherwise? It doesn't dictate that you have to have one. It says, how does the function get done? So I think that's a kind of healthier kind of dialogue to be having with colleagues.
So I think seeing the operating model paper and the board assurance framework paper together feels, in my mind, like the right thing to do. What I'm not clear about is looking to the future, when we will have the certainty that's required over this next 3, 4, 5 year period to allow us to make some of the final decisions. And again, I come back to this issue. A lot of the technology development talks about alpha and beta frameworks, where in a sense you make a judgment and a decision about what you're going to do, and you adopt the operating model framework, and then you flex it in the light of experience and the changing context you're in. And I'd much prefer us to adopt the mindset on both the Bath paper and this paper that we do have an operating model, but it's an operating model that we're going to flex in the light of the different contexts that we're going to enter into, as distinct from, I think there's a sentence in this paper that says we've been doing this work since March 2020. Well, it's now July 21. And actually, I just think we need to bring as much of this to a conclusion as we possibly can that sets out what is the decision we're going to do. So in my preference would be, and I'd ask the exec team to think about this, is to think about having both the BAF and the operating model in place. So when we do the 6-month review of our 21-22 business plan in the autumn of this year, and we drop the flag on planning for the 22-23 year, we go into the 22-23 year with an approach to the business planning, approach to the BAF, and an approach to the operating model that is in place. And of course, we'll have to flex all of those. And I think the point that Andrew and Liz are making is we're going to have to flex that differently across the different regions because they're going to go at different speeds and different levels of development. What I want to avoid, though, is keeping some of our architecture, our governance architecture and delivery architecture in an existential state of constantly becoming, so we can never make the decision about what it's going to be. Let's make the decision and then flex it in the light of experience. And I think that's just a mindset, a positioning change from the way the papers have been drafted. On the content of what we're going to do and who's going to do it, I think it's pretty much in the right place, to be honest. There's nothing I can add to it, David, and you and colleagues are doing the work on a daily basis. But that was my reflections, having read the papers and thought about it. And you and I have the opportunity, David, to catch up. So you've kept me fully briefed on this as we've gone through. So I have the benefits of that as well. Navina, you're flagging. Do you want to come back?
Yes, please. Just very quickly. So as I'm listening to this, I want to make a statement about variation across the country and how HEE must be responsive to the variation because we are closely aligned to what is happening in service and to the needs of the population. So we need to be clear about warranted variation, and we need to make sure that we are able, through the board assurance and through the committee and through how we do our work around governance, that we are describing warranted variation and that we are giving you assurance, sufficient assurance about our ability to respond to and deliver on our mandate within the confines of that warranted variation. And I think we can test our current committee structures, the assurance framework, and our other structures, including our own operating model, to deliver on that promise or ambition, and that we will flex it according to kind of what's going on in real time.
Okay, no, very good, very good. I am going to move on. David, I'll let you have the last word, but Lizzie Smith, forgive me, I should have invited you before I spoke. Is there anything you want to add, Lizzie?
Yes, so I did have my hand up. I'm not sure it's working, but not to worry. Just to say, I think what Liz has pointed out and other people in the group, it's really, really important. We can't have this conversation in some sort of bubble of not understanding the vast variation on the ground. And I think what's been really encouraging about this work is the fact that it's really encompassed that the engagement with systems has been very strong. The point about the CPO in a system is a really, really important one. There's a huge amount of variation there, which I think is a challenge. And in London, they're not planning on making those executive appointments, for an example, as example. And it's quite difficult to navigate our way through some of the stuff. But this operating model stuff, for me in HEE, working with HEE as long as I have, we've never had the clarity of thinking that we've got to in this point. So I really welcome Sir David's comments and Navina's comments that to actually start to operationalise some of this would be so valuable, because actually I think the framing around planning, the engagement with partners, the engagement with the other national conversations, the kind of the fact that that's all complementary, but we've actually moved ourselves forward really well within all of that complexity and confusion, I think is quite remarkable. So we're feeling very optimistic and energised about this within the regions, and excited to see where it goes next. But absolutely hear people's comments, and you know the challenges are very real.
Thanks, Lizzie. Sorry, I didn't see your hand, so I don't know whether I don't know what the challenge is with the technology, but it's good to get your voice into this conversation, and thank you for all the work you're doing. David F., do you want to just have the last 2 or 3 sentences on this?
Just 2 points really. I think I absolutely recognise the variability, the different levels of development in ICSs, and actually we need to have our core offer that's adaptable depending on where the ICSs are, where they see themselves, and what they want of us. But the other thing is we've got to get into a system where adapting the operating model becomes business as usual in itself. So rather than keep bringing it back, that we get into a process where we recognise regional difference and we recognise national change, and we get into a process and routine of automatically updating as we go. And I think that's our challenge in the next quarter to describe that.
Well said, and David, thank you for leading this work on behalf of the board as well. It is, as Lizzie said, it's massively important to make transparent what it is what we do, and you know, we will be judged by what we do, not what we say. So this is a way of actually getting clarity into that. So thank you for that. Right. Just with one eye on the clock, move to item 9, if I may, which is the section on operational delivery and assurance. And Callum, you're next up with the finance report. Pretty much washes its face and is self-explanatory. Basically, it's at month 2, which is too early, but it all looks green at the minute. I paraphrase as a non-finance person, but do you want to put some formal language around that?
You have pretty much said it. So yeah, I mean, you can see there's a few ups and downs and some year-to-date stuff. We've had so little of the year. It's kind of very pretty normal. First 2 months. What's more important is kind of the outlook is on track, but it is very early in the year, so you know you probably wouldn't expect much less. I've pointed out the fact that our biggest financial risk is the impact of the cost of extensions and COVID impact, and that has been our process for that is set out, has been looked at by Performance Assurance Committee, and we'll be reporting back on the actual impact when we've got the actual data later in the year. But that's in as good a place as it can be given the inherent uncertainties. But no, I'm just happy to take questions if anyone has any.
Any questions for Callum? No, I think, and you flagged when we were setting the budget, Callum, that was the risk. We began the financial year knowing that was the top-rated risk that we face. So we need to just thank Andrew for keeping his eye on that through the committee, with you making those reports to the Performance Assurance Committee. Thank you for that. David Farrelly, do you, in a similar vein, want to comment on the performance report?
Similar to Callum, really. Quarter 1 report, some is rollover of the targets that are over 2 years, and some are startups, so very green at this stage. The only area I think Andrew mentioned earlier, which was around training hubs, the problem is slightly moving, and it's not necessarily about funding recurrency now. It's more about the operationalising of it and getting the operationalising of it through procurement in a timely way. So fairly confident that we are on top of that one, and it will resolve relatively quickly. All other areas are where we'd expect at the time of the year.
So do we have our hands on all the levers to make that improvement in the primary care hubs, David, in your view, or are we dependent on other bits of the system to make that work? What's the balance between what we need to do and if others need to do something?
This bit of this risk is within ours.
Okay. And are you satisfied we've got the arrangements in place?
I am, and we're reviewing it regularly through our National Finance and Performance Committee regularly, and we've brought that back into PAC as well, so we've got a loop to make sure we're on top of it. Okay,
very good. Thank you, David. Any more questions, comments from colleagues? Are we content to accept both Callum and David's reports? Thank you for that. I think that brings us to the completion of the agenda. So thank you. I've not been notified of any other business. If I could invite you to stay on the line, but could I ask you to formally end the meeting now and end the recording? Is it Matt I'm asking to do that? I'm not